Hello, I'm Valerie Henry, Director of Non-Acute Healthcare Services at the Joint Commission. Accreditation, a team sport? Absolutely. I was reflecting how sports teams and individual athletes prepare for the Olympics, my own past experience as a collegiate gymnast, and having worked on a healthcare team preparing for an accreditation survey, I thought what a great analogy to use the team sport aspect for this presentation. Accreditation preparation, as in sport, is a team effort. And just as I experienced in gymnastics training, also includes individual performances, which ultimately contributes to the success of the team. As a whole, the team can win the gold medal, utilizing each team member's strength to contribute to the overall success. We also recognize that coaches or leadership are ultimately responsible to the success of the team. Let's get started by looking at the overall agenda. But first, the disclaimer page. I'll let you all read those first three paragraphs, and then I'm just going to highlight the fourth. The Joint Commission's participation in this presentation is sponsored by Garfunkel Wild. PC is on a non-exclusive basis. This is not an endorsement of the sponsor's products, nor a statement that its expertise or services are superior to those of other comparable companies. And so today's discussion points to be covered: accreditation, the what and why, a process overview, ongoing survey readiness. We really want to look at accreditation and survey readiness as a performance improvement exercise, if you will, not just a culmination to that survey day. And then the role of leadership. They are ultimately responsible for a success. Accreditation may be required or a voluntary process, and it's a mark of distinction that demonstrates to the public that you are committed to delivering a higher standard of care. This invitation of the outside expert, so that third party taking a look to review your organization, is confirmation for the public and stakeholders on the safety and quality of care, treatment and services provided, and can differentiate you from your competitors. It improves credibility. Again, establishes your reputation with that external validation and differentiates your organizations from others for marketing and investment or financing purposes. The mission of accreditation is to increase standardization, whether in a single site or a multi-site healthcare organization. This reduces unnecessary variations and lowers your risks, and ultimately leads to improved quality of care and patient safety. A Becker's article example read that ASCs, so we're talking about ambulatory surgery centers in this example, in recent years have seen an increase in nuclear verdicts when juries award more than 10 million. Recent cases highlight the significant financial consequences when things go wrong in an ASC setting, according to this report from Becker's. And there are three notable examples they shared of high jury verdicts in recent cases, including one nuclear verdict that was awarded more than $24.6 million. There was another $4.2 million settlement and a $1.1 million settlement as these results. One of the first recommendations the report advises implementing to reduce and minimize risk is to standardize. What are some other ways that accreditation may be a benefit? Accreditation can be recognized by payers and other healthcare organizations with whom you might partner. This could reflect and affect referral volumes, access to patients, and reimbursement rates. Also, consider the operational efficiencies and consistent performance improvement that can be achieved through accreditation. The cornerstone of accreditation has always been reducing the risk of unnecessary harm to patients through standardization of care processes. In fact, our goal is to help you achieve zero harm. And this obviously can minimize the risk of unnecessary harm and related costs associated with lawsuits and liability costs, as I mentioned in the previous slide. And finally, many healthcare organizations have indicated that in today's staffing environment, accreditation can help with the attraction of new talent, as well as the development and retention of existing employees. Accreditation creates a safe, efficient, and educational environment that once again is sustainable and promotes the competency development of your entire team. Accreditation is available for a multitude of settings, and these are just a few examples, and they are not limited to these settings, but I wanted to highlight the ambulatory surgery centers, which include office-based surgery, medical group practices, your telehealth, whether it be telehealth within a group practice or standalone telehealth specific organizations, diagnostic imaging facilities, urgent care centers, kidney care providers, sleep centers, community health centers, and your worksite health clinics. Let's look at the process of accreditation. When you first join an athletic club or a team, you get to know the key coaches, leaders, staff, their offerings, and the structure of that club or sport team first. The accreditation organization's role of onboarding you is to get to know you, get to know your healthcare organization and your accreditation team. So they'll provide a welcome and an overview of their accreditation process. They should get to know and understand your organization goals, vision, and structure. Why are you pursuing accreditation? They can help you identify and establish your timelines for survey readiness, and also work with you and understand your educational needs and provide the resources needed to prepare accordingly. They'll help with readiness by providing access to the standards and an overview of the survey process. Again, you may have some very seasoned team members that have been through a multitude of accreditation surveys, or those that are brand new and may need a little bit more guidance and resources as they prepare. They'll provide support as you complete your application, and then post-application additional resources that will be valuable as you continue preparing to that survey ready date. Once the healthcare organization begins preparing for survey, a first step is to review the standards. This will help the organization identify a potential timeline to survey readiness. Remember, you select your survey ready date. Assemble the key team members, and if the organization has the staffing resources, because we understand there are very small organizations that come in for accreditation, and it could just be a person or two, to the very large organizations that have a multitude of resources. But if you have those resources, assigning chapter champions to manage each chapter and the expected requirements. Conduct a gap analysis and socialize this with the accreditation team and leadership, as the team as a whole needs to be aware of the progress and areas that still need to be addressed for survey readiness. Mock tracers are a valuable activity to perform and can identify areas of strength and those needing further attention as you prepare for survey. Some tips for preparation is get organized. Identify and assign staff responsibility and expectations. Develop a timeline for each phase of the survey preparation. Meet on a regular basis. I have teams that initially meet monthly or every other week, and then as they get closer to survey, on a weekly basis. Have complete documentation and have the documentation readily available, and assign the staff who will be responsible to produce the documentation upon surveyor request. And don't provide more than what's required, and make sure that it's accessible and readily available so the surveyors don't have to be digging into additional documentation areas for what they're seeking. The expectation is the healthcare organization will meet the standards and do what they say they do in their policies and procedures. If you have policies and procedures that are above and beyond the standard expectations, you are held to your policies and procedures. So if you're not performing to those, and even if they exceed the accrediting organization's requirements, that is an area that would be scored because you're not doing what you say you will be doing. So the more each team member understands the why behind the standards, the more meaningful the survey and a better understanding of their importance. So when to apply? Well, the timeline is variable. I like this graphic. It gives you a good visual, but it is very organization specific. So let's say you're a de novo, a brand new center that's being built, or a big remodeling project. You're going to be waiting on the receipt of that certificate of occupancy, licensure if it's required in your state, and then 10 cases completed prior to the surveyor's arrival. That said, a best case scenario is 3 to 4 months in advance of the survey ready date, but 3 months is typically minimum, and I've had organizations with shorter timelines. But it varies, again, based upon those certificate of occupancy, licensure, etc. The further out an application is submitted, the more potential your accrediting organization can schedule closer to your requested survey ready date. Because remember, you're telling us when you're survey ready, and we won't come before that date. Another example is if a site has been in practice for many, many years and then decides to seek accreditation, they most likely can submit their application 4 to 6 months in advance. Since they aren't undergoing any construction delays, they're not butting up against an expiration date of any sort. So work with your accrediting organization to help determine a timeline based upon your specific scenario. Healthcare organizations can utilize accreditation to grow and develop their teams, as leadership identifies those team members that want or should be team leaders. Use the accreditation preparation as an opportunity to grow their skill sets. Identifying chapter champions who prepare in their genius areas and report out on progress during team meetings is a valuable experience towards their development. I can reflect back upon when I was a new employee at a healthcare organization and they were in the throes of preparing for a survey, an accreditation survey. And being new, I was just making sure my documentation was in place and all my educational requirements were up to date. But as time went on and we went through more survey cycles, I was one of those chapter champions based upon the area that I managed. And it was such a valuable experience. I had a better understanding of the whys we were preparing to the standard expectations, the value of having those third-party eyes on things that we might just be overseeing because we're there doing things day in and day out. And as important, being a part of that team preparing. It develops stronger, cohesive relationships. And afterwards, once we received that accreditation, it felt I had more skin in the game. It was a more meaningful survey experience. And then the celebration with the team was, again, a much more valuable experience for me. So educate your staff about the survey process. Encourage staff to be open, to learn, share, and seek to understand. If an organization is eager to grow, learn, and improve, the more educative information is likely. So, to be redundant, but it is valuable, the more the team knows and understands the whys behind pursuing accreditation, the more engaged they will be, resulting in a more meaningful survey, and the accomplishment will be more valued. Thinking about how different people learn, I'm a visual learner and I like pulling up a few picture examples. This happens to be a picture of commonly cited environment of care um, pictures. And the organizations, one of the requirements is the organization labels utility system controls to facilitate partial or complete emergency shutdowns. So we're looking at that control circuit panel to the left, and one of the survey observation was that a requirement is that the fire alarm circuit breaker is red. Somehow it's either a red switch or you can use red nail polish, but it was not marked in red. So in an emergency, finding that fire alarm circuit breaker would be a challenge. Also, on the circuit panel, there were 7 circuits in the on position that were labeled as spares. This was confirmed by facility staff, so the surveyors walking, talking, and working with them. And so in an emergency, what do you know that you're going to shut down? You have no idea what those are connected to. So a solution, and this is really the understanding of some of the whys behind doing this, is, make sure the panels are audited, especially after electrical projects. If you're doing remodeling or construction or expansions, don't forget to check what changes have been made and update these accordingly. The circuit panel as an example. To the right in that picture is the photo of the medical gas shutoff valves. And what I hear from surveyors is that many times, this particular example, the emergency gas shutoff is rather flush with the wall and there were carts in front of it, etc. And so again, in an emergency situation, you don't want to be moving and having access issues in order to get to those shutoffs. Another commonly cited life safety standard is the space around pipes, conduits, cables, wires, air ducts, or pneumatic tubes penetrating the walls or floors are protected with an approved fire-rated material. And there's a very small description in the upper picture where it says, shows unsealed pipe penetration in a 2-hour concrete block wall. And then the lower one correlates with the note on this slide that non-approved polyurethane expanding foam is not an accepted fire-rated material for this purpose. And that's per the National Fire Protection NFPA's requirements. And so what the surveyor had observed is that there were numerous penetrations that were not sealed with fire-rated material at the pipes and conduits. And there were holes in the 2-hour fire-rated barrier in the main operating rooms. And again, they observed this with the director of operations. So they're looking and seeing this. And this is where it's important, where you don't just have staff go to Home Depot and spray that foam because it's not an approved fire-rated material. A solution to these is have your maintenance staff, or many of organizations have vendors coming in to do the work or that are doing the construction. Make sure they understand the requirements needed for these types of changes that are done within your organization. The survey process objectives, the surveyors are there to validate your compliance with the standards, and if doing a Medicare deemed status survey, the conditions for coverage. They'll provide a meaningful assessment. They want to know what's most important to the healthcare organization beyond achieving accreditation. Accreditation can assist you in your journey toward becoming a high reliability organization that provides consistently safe, high quality care to every patient every time. High reliability organization is a culture. and it aims for error-free performance and safety in all procedures, even in hazardous or high-risk environments. High reliability organizations have predictable and repeatable systems that help with consistent operations and to catch and fix potentially catastrophic errors before they happen. And the surveyors should inspire and encourage improvements through their interactions with the leadership and team members. What happens after the survey? You will receive a preliminary report. I know at Joint Commission, you'll get a preliminary report on the last day of the survey that's open for 24 hours. So you can look at those areas that may have been scored. We happen to call it requirements for improvement. Then you'll receive that final accreditation report from your accrediting organization. And this will have the content of those final findings, score findings, that will be required. Now, I can speak to our experience is that there is a 10-day clarification that if you see something scored and you have a rebuttal around it, you have 10 days to do that. But in other, moving that forward, if there are requirements for improvement, it is not a pass-fail survey. You have a 60-day time frame to submit your evidence of standard compliance. So these are the requirements for making those corrections. Once those are submitted and accepted as corrected, you will receive your 3-year accreditation award letter. So again, it's not a pass-fail. We want you to succeed. So work on getting those corrections in, and you don't have to wait those full 60 days. You can turn that around as quickly as possible for your organization. And I know many times if it's a deeming status, you want to get those done as quickly as possible. Ongoing survey readiness. So we like to think as the survey as that culmination of all the preparations, but we want to look at being survey ready every day. It is the goal of being a continuous performance improvement organization where you're always looking to be survey ready, always looking to improve. And there are a multitude of resources from your accrediting organizations to support that continuous improvement. And as I mentioned, while a survey may be a pinnacle point in continuous readiness and survey readiness, a goal should be that survey readiness every day. It should be just how your center functions. And there are tools and resources your accrediting organizations can provide to help you prepare and be an improvement organization beyond that survey experience, and to aid in the support of performance improvement efforts, whether it be via modules, webinars, dashboards, or portals. Use these to develop the team in becoming a continuous performance improvement center. I threw up a few here that the Joint Commission provides. We have a monthly newsletter called the Perspective Newsletter. We have a data analytics tool called the Safer Dashboard, a heads-up report that uses frequently high-scored standards, and then it shows to get to those root cause analysis, and then a checklist your organization can use against that in preparing for your survey. We have a standards interpretation group. They're the people that write the standards you can go to for Q&A. A readiness roadmap that provides hundreds of documents, checklists, videos, etc., that prepare you based upon where you are in your journey. It's like a roadmap. You look where you are as you're progressing. And then a survey activity guide that helps you prepare and see the expectations before, during, and after survey. The role of the coach, also known as leadership. At minimum, leaders include members of the governing body and medical staff, the CEO and other senior managers, nurse executives, clinical leaders, and staff members in leadership positions within the organizations. Competent and thoughtful leaders contribute to improvement in safety and organizational culture. They understand that systemic flaws exist, and each step in the care process has a potential for failure simply because humans make mistakes. Leadership's number one priority is to be accountable for effective care while protecting the safety of patients, employees, and visitors. A leader is committed to prioritizing and making patient safety visible through everyday actions and is a critical part of creating a true culture of safety. Team members measure an organization's commitment to culture by what leaders do rather than what they say shall be done. Just as coaches oversee their athletes performing high-risk routines to assure safe and effective technique, leadership is the ultimate oversight in a healthcare organization, especially for areas identified as high risk, which are your high-level disinfection and sterilization areas, your surgery, your ORs, and dental areas as well. I would be remiss to not address the role of the administrator. In most sports, there's a captain of the team. And with many of the ambulatory healthcare organizations that we accredit, that I've worked with personally, the administrator is that captain. I asked our field director, who oversees our ambulatory surveyors, to share his pearls of wisdom from when he was an administrator at an ambulatory surgery center. Here are those pearls. Leverage your medical director. Keep doctors happy. Applaud and appreciate your staff and understand what motivates them. Create socialization to connect your staff and be open to new information and processes. And most importantly, promote a culture of safety. Use your associations as additional resources. I can't emphasize this enough. Lean on your associations. I've only listed a few here, but they have incredible resources and there's such networking opportunities. Leverage those connections. I hope you enjoyed this twist on looking at accreditation as a team sport. We're all responsible for an organization's accreditation success. Thank you for your time today.